Hi, so let us discuss about the shoulder joint. We will discuss about some concepts and understanding of pain in the shoulder joints and in some structures around the joint. We all know the importance the shoulder joint assumes in our everyday life and functions. Apart from just lifting objects, lifting the hand up for gestures, we do a lot of other tasks with the shoulder joint. If you can think about some tasks, I give you 10 seconds. So, in this time, if you could think of pushing, pulling, carrying objects, apart from lifting, throwing and catching. Definitely not crawling like animals or climbing on the trees. So, as we assume, unlike crawling as a weight-bearing function or climbing on the trees, the function the shoulder assumes in human being is very different from other animals. And that could relate very well to the shape of the body as well as the joint itself. With the needs of high mobility and faster movements, the shoulder has compromised on stability. So when I say for high mobility, it has compromised on stability, I am talking about less than optimal congruence between joint surfaces. That is, the structural surfaces of the joint are in less than optimal contact with each other. The most glaring example of such a joint is the glenohumeral joint itself. With a very small glenoid and the large humeral head, the skeletal stability is dependent on soft tissues and structures around the joint. With glenoid as the only articular linkage between the upper extremity and rest of the trunk, the scapula assumes a more than significant importance in the functions of upper extremity and in the kinematics of the shoulder joint. Now we all know and have read multiple times about the scapulohumeral rhythm, how the scapula, apart from providing a stable base for the humeral head, also coordinates with mobility of the joint. And why is the scapula so important? It is because it forms a false joint or a physiological joint with the thoracic cavity or the rib cage. With no ligamentous attachments, the joint itself is dependent on motor control and the muscle coordination with their attachments on the scapula, the thoracic spine, the cervical spine, and the humerus. So in such a scenario, it would be needless to say how important it is for the correct positioning of the scapula over the thoracic wall. Any aberration or abnormal positioning or movement control of the scapula could lead to either dysfunction in the movement or produce symptoms like pain. It would be more than unfair if we neglect other joints of the articular complex, which namely are the glenohumeral joint, the sternoclavicular joint, the acromioclavicular joint, apart from the glenohumeral and the scapulothoracic joint. The advantage of such an interlinkage is that the work is shared between joints. But on the other side, the biggest disadvantage is any slightest amount of dysfunction anywhere across the chain can impact the most vulnerable. And in this scenario, it seems to be the glenohumeral or the shoulder joint, which bears the brunt due to higher demands of mobility and range of motion. limiting my understanding to within the articular complex of the shoulder girdle, I may be missing an important and a very essential linkage between the kinetic chain of trunk and the lower extremity. With demands of mobility at the joint, the trunk and the lower extremity pitch in with their roles. And I must say that the workload at the shoulder girdle is distributed not within the complex but even outside at the lower extremity and the trunk. So the next time you go searching for the reason of impairments and symptoms in the joint, don't limit yourself to the glenohumeral joint. The idea to understand the structure and kinematics of movements across the shoulder are just not limited to the assessment, examination and preparing for management, but it is very important to plan outcomes and prognosis. This understanding leads us to the best plan of care in patients with shoulder impairment. Now, I must say, in musculoskeletal complaints, especially pains, after low back pain, shoulder pain is one of the most common complaints across populations. Now, my question to you is it the pain or is it the impact of pain that you would like to address? You might think, how are they different? Because it is the pain which impacts activities, participation, and thereby leading to disability. So, if during my management I choose to address pain, I am indirectly working on its impact on life. But here is the catch. Now, every patient may behave very differently from the other. The patient with same amount of pain with a similar diagnosis may present very differently from another patient.